Thanks, Chair. Minister, I want to start on a very, very positive note in regards to the last 18 months, which have been testing, to say the least. The doctors, the nurses, the auxiliary staff, the care staff, and everybody that works in hospital had the most challenging 18 months of their professional life. They saw their patients, they saw their loved ones and family members die of this particularly terrible, terrible disease. And the public health system, protected us, saved us, and, it came at its greatest hour. It saved many, many, many people in the most difficult of circumstances. And not standing with that, Minister, the public health emergency that we have faced, Ireland before that had one of the highest waiting lists for inpatient and outpatient care in Europe. And as a consequence of that pandemic, I believe the parameters have changed fundamentally. And them parameters are what people accept and what they don't accept anymore. And underfunding and the kind of mismanagement of our healthcare system has led to this crisis of waiting times for procedures and surgical procedures. And that is completely not acceptable. And I think we all agree in that circumstances. But there's obviously a reason why that happens. And it's not a simplification to say that is down to policy of successful governments. That is. If you look at the policies of a two-tier health system, which we have, it's private healthcare and public healthcare. And once you have that kind of split in society, then you will have a dysfunctional health system in its kind of guise. And I know Deputy Shortall mentioned about Sláintecare. I don't think it bodes well in regards to the resignations recently. I think that there's obviously reasons why those members have resigned from Sláintecare, and I think it doesn't bode well whatsoever in relation to reforming our health system. And Sláintecare was that vehicle. I do have kind of issues with that. The policy of Sláintecare, but it was going in a general direction to see a universal healthcare system. And when we see waiting lists, there's obviously huge numbers and there's people behind them. But if you're from a socio-economical disadvantage, waiting on a procedure or an operation, the consequences of that will be kind of severe. And you've seen in Britain, and again, Deputy Shortall mentioned the NHS. I mean, the NHS is a cherished institute in Britain. It came from the ashes of World War II. And I don't know who said it, but somebody said, if you don't give people a health system, they'll give you a revolution. And I think that's, we have to learn the lessons of this pandemic, that the parameters have completely changed. And them parameters, Minister, you have to address the issues around recruitment, capacity, and the legacy, historical legacy of those that are waiting and those that have that split in society between private healthcare and public healthcare. So they're the parameters, Minister. It's up to your government to address them. I see in your statement. I mean, it's positive enough. I think we're at the tail end of this pandemic in this country, hopefully, and I think your government will kind of focus on trying to address these issues, because if you don't address the issues of waiting times, Minister, then the political cost will be extremely painful, and that no doctor can remedy. Thanks.